Okay, let's get right into it. We're talking about a true medical emergency, one where every single second counts. This isn't just some textbook lesson, this is a real-world playbook that could help you save a life.
Our mission today is pretty straightforward. Cut through the confusion, really nail the difference between SCA and, that other heart issue people talk
Heart
about.
attack, yeah, huge difference.
Right. And then arm you, the listener, with the steps, the protocol that bystanders absolutely need to know.
Michael, on behalf of everybody involved, we don't think there's anybody more deserving than to be involved in here. Thanks. Really.
Hey, Kevin Brody. Nice to meet you. I was there. I'm glad.
Oh, you were? Thank you. A couple more guys for you, Mike.
You're welcome.
They weren't able to make it last day, so they were all on the call. Mike, good to see you again.
Good to see you.
Take care, buddy.
Nice to meet you again, man. What do you remember, Michael?
From the incident?
Yeah.
I don't know, I just remember being on the bus and waking up in the hospital after and getting told I passed out on the court, basically. Just thank you for everything they did, and they did a great job, and I'm just thankful to be here.
It's never good in a gym when things go silent. So I was kind of around a curtain and kind of getting to the point where I could see both courts. I saw Michael on the ground. The referee was pointing at his head and summoned me out onto the court, and then that's basically kind of where everything started.
I just kept saying it was a nightmare to look at the other end of the court and see them pumping his chest.
I think the big thing was just the early recognition by the trainers. For them to be able to do CPR prior to us is extremely important. By the time we get called and we get dispatched and we get on scene, it's definitely a couple minutes that goes by. And every minute that goes by, his heart isn't pumping if nobody's doing anything. So what they're able to do is, them doing early CPR allows them to deliver that oxygen-rich blood to his brain, and that's why we're having such positive results with Michael today, as he had early CPR and early defibrillation.
In each of our schools, we have at least one defibrillator, and we train each year an emergency response team for each school so that they're prepared and ready in the event of a cardiac event.
But it was one of those things where the emergency action plan kind of all came together, even though the parts didn't know each other. West Dallas Fire Department and the EMTs and the paramedics did an unbelievable job, and it was seamless and ended up being a great day.
One of the questions we're sometimes asked is why schools, and an interesting statistic is that 20% of the U.S. population, both adults and children, are in a school at any time during the day. So it's a place for a lot of traffic, both children and adults. And there's a lot of people around, and you have a lot of people who are able to respond in emergencies.
We don't know why he had this arrest at the time, and so through subsequent evaluation, we found out that he has a heart condition that likely caused it. But the reason that he's walking out of the hospital today is because of the prompt response by the people that were available at the scene to recognize that he was in trouble and provide CPR promptly and get an AD ready and have it available for defibrillation.
To Children's, which happened to be 10 minutes up the road. We usually don't play in this area, so to be close to this hospital and to have that trainer there who, all the doctors up on the trauma floor and all of his doctors said he got excellent CPR, and that made the difference. He not only got CPR, but it was really good CPR. So we credit the trainer, the guy who called the 911, the paramedics, everybody. There's a whole chain of events that happened, and one of those goes away, and he's not here. So
it's a skill that if you have, you might be able to save someone's life someday. For a problem like this, we're not interested in the medical professionals. We just want people who are willing to take action. And I think they've looked at the barriers for this. People are sometimes afraid they're going to do harm to someone. Well, unfortunately, when someone suffered a cardiac arrest, there's nothing worse that can happen to them. And all you could possibly do is what happened today, is that you could save somebody's life.
And I want to start with a fact that is frankly shocking. Get this. Sudden cardiac death is the #1 cause of death in athletes. We're not talking about folks in their 80s or 90s. We're talking about people at the absolute peak of human performance. That right there tells you this is something we all need to understand.
Hello, I'd like to tell you about... Oh, didn't expect that. Hey, sudden cardiac arrest occurs when the heart stops beating properly. Sudden cardiac arrest is an electrical problem caused by an abnormality in the heart's electrical system. The heart's pumping action is disrupted, and the heart can't pump blood to the brain, lungs, and other organs. Seconds later, the victim collapses suddenly, appears lifeless, and is not breathing, or is abnormally gasping for air. You may see several seconds of seizure-like symptoms. Hello? Not true. Cardiac arrest can happen to anyone, anywhere, anytime. Although more commonly seen in those who have heart disease, cardiac arrest can also strike those with no history of heart problems at all, and can be caused by recreational drug use, electrocution, or even a sudden blow to the chest. Sudden cardiac arrest is the leading cause of death in many countries, and its survival rate is less than 1% worldwide. No, cardiac arrest is not the same as a heart attack. Think of a heart attack as a plumbing problem. It occurs when blood flow to the heart is blocked. Victims of a heart attack are still conscious and may complain about symptoms such as shortness of breath or discomfort in the chest. In contrast, cardiac arrest victims need help right away. Every minute without help means the chances of survival drops by 7 to 10%. That leaves only a golden survival window of only 10 precious minutes. So better get moving.
So we're focusing on sudden cardiac arrest, or SCA. And you know, the biggest danger isn't just the event itself, it's the confusion. People freeze up because they don't know what they're looking at. So our whole goal here is to just cut right through that noise and make things crystal clear. All right, let's tackle the biggest mix-up right out of the gate. Heart attack, cardiac arrest, they're basically the same thing, right? I mean, we hear those terms used interchangeably on TV all the time. But the answer is a huge, resounding no, and knowing why is the first critical step.
So how do we make this difference stick? Easy. Let's use a really simple analogy. Think about the heart like it's a house. Trust me on this one. You can boil it all down to a plumbing problem versus an electrical problem.
So a heart attack, that's a plumbing problem. It's like a clogged pipe in the house. A blockage, usually a clot, stops blood from getting to one specific part of the heart. Now that part of the muscle starts to get damaged, but the rest of the heart is still trying to pump. And here's the key. The person is usually awake. They're conscious, often clutching their chest. The lights are still on in the house. Now, sudden cardiac arrest, that's the electrical problem. This is a total system failure. This isn't just a clogged pipe. This is a citywide blackout. The heart's entire electrical system just goes haywire. It might quiver or it might just stop. And when that happens, blood flow stops instantly. The person just collapses. The lights are out.
What are the general causes our sources list that can lead to this sudden electrical shutdown?
Yeah, the triggers vary. In adults, the most common primary cause is underlying cardiovascular disease. Something was already wrong with the heart's wiring or structure.
Okay, so pre-existing heart conditions, often the culprit in adults.
Right, but it can also be secondary, meaning the electrical failure is triggered by some other major event hitting the body. The sources list things like breathing emergencies, choking, drowning, severe asthma attacks.
Makes sense. Lack of oxygen stresses the system.
Exactly. Also, severe trauma, like a major injury, electric shock, obviously, or a drug overdose. Basically, any massive systemic shock can throw the heart's rhythm completely out of whack into that chaotic state called ventricular fibrillation, or VFib.
Or just stops altogether, asystole.
Or just stops, flatlines, yeah.
Okay, now here's where you said it gets really interesting. Because the reasons why someone collapses can be really different depending on age.
Hugely different.
Adults often have that underlying heart disease.
Right.
But for children and infants, the sources point to a different set of main culprits. What are those specific vulnerabilities for kids?
Right. For kids, the big three mentioned are 1, breathing emergencies, again, super common. 2, chest trauma, think impact in sports, a hard fall.
Yeah, you hear about that sometimes. Commotio cordis.
Exactly. And 3, congenital heart disease problems they were born with.
So why is knowing that difference, adult causes versus child causes, so critical for someone responding on the scene?
Because it changes your immediate focus, potentially. When an adult collapses, your first thought is often, okay, primary electrical failure, get CPR going, get the AED, shock them.
Right, fix the electrical problem.
But with children, their hearts are often, electrically speaking, pretty healthy to start with. They're more resilient to just poof, going into VFib on their own.
Okay.
But their whole system is incredibly sensitive to a lack of oxygen, hypoxia. So when a child has a severe breathing issue or chokes or has trauma affecting breathing, their oxygen levels crash.
I see.
And that extreme lack of oxygen is what then causes the heart muscle, which needs oxygen too, to eventually fail and arrest. It's often secondary to the breathing problem.
So if we connect this to the bigger picture then, for a child, if you can fix the breathing problem quickly, like clear an airway or give rescue breaths,
You might prevent the heart from arresting in the first place. Or if it has arrested, getting oxygen in fast is paramount, even more so maybe than just compressions initially, depending on the scenario.
it emphasizes that focus on airway and breathing in kids. That might be the key to saving their heart.
Precisely. Understanding the likely why helps you prioritize the what.
Okay, this is incredibly helpful. We've defined the emergency, the key signs, the common causes.
So let's lock this in one more time. Heart attack is plumbing, a blockage, and the person's usually awake. Cardiac arrest is electrical, a malfunction, and the person is unconscious. It's a circulation problem versus a total shutdown. And it's that shutdown, that electrical failure, that we're laser-focused on today. So what if you see someone just collapse out of nowhere? How do you know if it's that electrical failure? How do you know that it's officially go time? Well, there are 3 unmistakable red flags you need to look for. This is your checklist. No guesswork here. Number 1, they are unresponsive. You can shout their name, shake their shoulder, you get nothing. 2, no pulse. And 3, they are not breathing normally. Now you might see these weird gasping breaths. It kind of looks like a fish out of water. That is not real breathing. If you see these 3 signs, you have to act immediately. All right, quick mental drill. You see those 3 signs? You've just identified sudden cardiac arrest. In that split second, what is the absolute first thing you do? Just think about it for a moment. And here it is, your playbook. It's simple, it's powerful, and anyone can do it. It's 3 words: call, push, shock. That's it. That's the mantra that saves a life. These 3 actions are what experts call the first links in the chain of survival. And honestly, they're the most important ones because they depend entirely on you, the bystander. First, you call 911 to get help racing your way. Second, you push hard and fast on the center of the chest. And third, you shock the heart with a device called an AED. So let's break down that push part. How fast are we talking? You need to aim for 100 to 120 compressions every minute. Now, if you're wondering what that feels like, I guarantee you know the song. It's the beat of Stayin' Alive. No joke. A disco anthem is literally the perfect rhythm for keeping someone alive. And it's not just about pushing fast. You have to push hard. For an adult, that means compressing the chest at least 2 inches deep. Yeah, 2 inches. This is not the time to be gentle. You are literally acting as that person's heart, pushing blood to their brain. And finally, the shock. CPR is amazing. It buys you time. But the AED, the defibrillator, that's the game changer. It's the only thing that can actually reboot the heart's electrical system. And the stakes are just incredibly high. For every single minute that goes by without a shock, the chance of survival drops by 10%. The urgency is off the charts.
Okay, so once those first crucial links are done, EMS is called, CPR is ongoing, the AED has been used if needed, then the professionals, the paramedics, the advanced medical teams take over.
Right, they continue the chain.
So just to complete the picture for everyone listening, what are those final 3 links in the cardiac chain of survival, the ones the medical pros handle?
Sure. So after early AED, Link 4 is advanced life support. This is where paramedics and hospital staff use advanced airways, like intubation, give specific cardiac drugs, manage IVs, that sort of thing.
Okay, more complex medical intervention.
Exactly. Then comes Link 5, integrated post-cardiac arrest care. This isn't just about restarting the heart, it's about specialized care after the heart is beating again. Things like managing temperature therapeutic hypothermia to protect the brain from injury, finding and treating the cause of the arrest.
Right, because getting the heart back is just the first step in recovery.
Precisely, which leads to the final link, Link 6, recovery. This covers a whole long-term process: hospital care, rehabilitation, physical therapy, emotional and cognitive support for the survivor and their family. It can be a long road.
6 links in total.
As you said.
So let's wrap all this up by talking about the single most important person in this whole scenario. And it's not a paramedic, and it's not a doctor. In those first critical minutes, it's you. You are the MVP, the real first responder.
Why? Because get this, a staggering 4 out of every 5 cardiac arrests happen outside of a hospital. They happen at home, on the soccer field, in the gym, at the mall. The professionals aren't there when it starts, but you might be.
And this is the bottom line. The whole chain of survival depends on those first few links. If a bystander doesn't act, if no one calls 911, no one starts CPR, and no one grabs the AED, the chain is broken before the pros even have a chance to show up. Your actions, they are the bridge from that person to survival.
When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services (EMS) system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR, and using an AED as soon as possible, you can make the difference between life and death for a person in cardiac arrest.
So we'll leave you with this final thought. Think about the places you go every single day. The gym, your office, the grocery store. You now know the signs, and you know the playbook. The stark reality is, when someone goes down, the most qualified person to act in that moment might just be you. The only question left is, are you ready?